As the director of Fleur, my goal is to create an integrative clinical environment that promotes and supports preventive medicine, to provide up-to-date comprehensive medical care for the treatment of women, and cutting-edge, state-of-the-art gynecologic surgery.
I'm an OBGYN nurse practitioner, and my primary role has to do with prevention. And for me, what's important is that annual exam. And a lot of times when people think about the annual exam, the pap smear, they think, it's just a simple thing. But that's the opportunity. It gives us our greatest opportunity to evaluate women about once a year on the things that are going on with them. We're screening for diseases. We're assessing how they're doing and projecting forward and helping to partner with them with the small issues to get them addressed, but also to tell them what's going on in healthcare, to help them optimize their own personal health, and to really partner for long term on keeping people healthy and well.
I think they benefit because we offer them the finest gynecological care in the desert, and Dr. Jacome offers them, in addition, magnificent obstetrical care. We have an office that is not duplicated in this desert. The facilities are unusual. The staff is fabulous. So I think the patient benefits from the care, the interest, the time, and the medical knowledge that they receive here.
Coming to the United States and training at Harvard UCLA Medical Center gave me the opportunity to get exposed to the most advanced surgical technology. Over the years, I became an expert in minimal invasive procedures. Most recently, we have embraced the most advanced surgical system for the performance of minimal invasive surgery, the Vinci surgical system. Da Vinci surgery is the most advanced, least invasive, minimal invasive option for the performance of a hysterectomy today.
I don't know, maybe 6 weeks ago, I discovered that I had an extra large fibroid, a uterine fibroid. It is a growing mass in my uterus that was about the size of a football, a little bit bigger. And it had contorted and twisted inside of my abdomen, causing all kinds of different problems. I was really amazed that this thing was inside me and that I had been living with it, but it did, I did realize why I was so uncomfortable and I wasn't feeling good, and this thing was just draining me of life. So when he told me that I had to have a hysterectomy, I was like, wow, I've never had any kind of major surgery ever. And I went home and I did some research on the internet, basically just to understand what a hysterectomy was, what had to be done, what were the complications, and to see if there were anything that I could get familiar with regarding my case or like my case. So when I Googled hysterectomy, fibroid, the Da Vinci system came up, and I didn't know what that was. And so I looked at it, and it described all kinds, what a hysterectomy was, different kinds of hysterectomies, and then it described how it was done with this amazing tool. So I really liked that idea, less invasive, quick healing. And I thought, boy, I really would like to have this done. I decided to choose the Da Vinci surgery over abdominal surgery because the Da Vinci is state-of-the-art, 21st century technology. And I say as an old-fashioned way of cutting the abdomen open with a long recovery and with the possibility of a lot more complications, the Da Vinci system seemed to me the superior way to go.
In our experience, this technology allows the patient for much faster recovery and a lot less pain.
To sum it up, I would go with the overused expression, I wished I'd done it sooner. I had struggled with this for many years, and now that I'm on the other side of it, it was much easier overall than I thought before it happened. But very quickly, I started to feel much better. And now at a month out, I feel like I've kind of been given my life back, and I'm very grateful for that.
At Fleur, we have physicians with expertise in all aspects of gynecology. From the most basic gynecologic conditions to comprehensive, complex gynecologic problems. Our team is dedicated to provide compassionate, individualized care for every woman.
I would definitely recommend Dr. Jacome to any of my friends. I wrote him a letter at the end of surgery because I wanted him to know how much I appreciated the role that he played in my surgery and giving my life back to me in this way. I appreciated all the effort he put in, the years of hard work and study and long hours at the hospital, all the skills that he had gained with all the effort he'd put in. I also appreciated that he would tell jokes once in a while and kind of make light of the situation. I told him that I felt that he gave me professionalism with a heart. And I really believe that. I felt like he was professional. He knew exactly what to say in answer to all my questions, but he also gave me time. And he looked me in the eye. I felt like he was warm and caring, but also very aware of what needed to be done and very straightforward and let me know what to expect. I really appreciated the whole experience, and I would definitely recommend him.
There's nothing more rewarding than seeing a patient smile after a complex gynecologic procedure.